Okay, we'll do a little, this topic is anxiety and depression. I'm going to go through this one fairly quickly. A lot of the statistics that you can read on your own. Just some highlights. Once again, when we talk about anxiety and depression, we're talking about this thing um, of subjective well-being. So our ability to feel good about ourselves by the way that we act. So some of the things that we can do, and we'll go through them here, um, to create this atmosphere within ourselves to make us, happy, and do it in a way that isn't bad for us as well. I mean, you can self-medicate, and that's not a good idea, right? So to control stress or anxiety, people consume alcohol or drugs or do things that are not good for us. So um, the idea is to do things that are good for us, and that will help control the stress and anxiety. So there's your subjective well-being. That being optimistic is really important here, and I think that goes along with being hopeful, understanding that once you set a plan in place to do something, for example, you're in this class and you want to get a good grade. So you've started this plan where you've got this class, you want to learn some things, get a good grade. So what are the other things that you can put in place to help you do that? And that's staying on time with your assignments, or maybe studying a little bit more, or working with other people so that you can understand their perspective of what's being learned in the class as well. All of those things are super important. And it involves not only interconnectedness within yourself, but also interconnectedness, social aspect with people as well. So students like to joke around and express this is a study was done, tends to help them with better moods. I think we can all relate to that. So there are different conditions. They commonly occur together, but anxiety and depression are definitely different. Feeling down and is pretty normal. I want to emphasize that. But if it lasts a long time, then we get into the point where we're starting to experience more of a depressed state, and we don't want to be there. So, but things do make us sad. But if we can, by talking to other people and being around things that are making us feel better, doing things that make us feel better, whether it's exercise or enjoying time with friends, that kind of helps pull us out of that downtime. Feeling blue or feeling sad, that's really important. If it becomes chronic and long term, then we have a problem. So here's your differences. Anxiety is something of more of a worry about a situation. It can cause tension. It can be have physical symptoms as well as neurological or mental symptoms. On the other hand, true depression lasts longer than a couple of weeks. We stop to lose interest in our normal activities, in our friends. We don't feel very good. We start to have self-doubt. All of the things listed there, and others, I'm sure. So it doesn't have to be everything listed there, but if this becomes sort of a pattern, and it lasts more than a week or so, then we need to start looking for some help, which is hard to do because read the bullets. We don't feel like going and get help. It's just really a tough place to be. We can look at anxiety disorders in a couple of different places, or a couple of different instances. This happens to be our number one mental health problem, anxiety in the US. Generalized anxiety disorder, it's excessive worry. We can also label that with panic attacks and some phobias. Many of us experience phobias in one level or another. Fear of heights, for example, or fear of spiders, or fear of strangers. And so some of them can impede our lifestyle. So if you're afraid of being in strange places and you're going on a trip, then obviously there's some anxiety issues you need to work out. So the reason why we show this slide the way we do is because understand that anxiety comes in different forms, and typically it's unique to the individual. Seasonal affective disorder can be one of those things. This is a very real thing. If you've ever experienced a move where you've moved from a place that was really sunny and all the time, like Arizona, and you move to somewhere where there's extended periods of darkness or cloudiness, like the Northwest, or even, I actually moved from Southern California to New York in the fall of my 11th year, and boy, it was tough, and experienced some of this seasonal affective disorder. It's a real thing, but it's kind of a short term, and there's things that you can do to fix it. But it is dictated by the environment, which is really unusual. So that's seasonal affective disorder. We can get into some serious ones. This is bipolar disorder, and you can read what it is. It's interesting to me, the number of American adults that are suffering from this illness. That's 5.7 million is a lot of people. Schizophrenia is another one. 30% of these cases occur in age groups between 25 and 35, and it's more frequent in women. Schizophrenia can be treated with some medication and counseling, but it's a very serious mental disorder that tends to progress. So these are two of the more serious ones. Major depressive disorder is another one, and it is one of the most common ones, and it goes along with what we talked about before, that hopelessness, the pessimism of life, that there's not a lot of hope out there. Looking at almost 4.5% of American adults, somewhere around 12 million people are affected by this. There are a lot of different factors that may contribute to this, as you can read there on the screen, and understand that because of the nature of this illness, it goes underreported. So if you look at those numbers, it may be a lot more than that. There are different types of depression, and once again, it's normal to feel down or depressed. It's sort of a response to our experiences in life when things happen to us. But if it lasts more than a couple of weeks, then we're starting to get into a depressed clinical depression state. So make sure you keep an eye on your friends and acquaintances, family members, if they're going through a hard time, that it doesn't last more than a couple of weeks, and then maybe get them some help, or for yourself for that matter. So this video I want you to watch. Some of the statistics are a little bit old, but it gives a really good background, some information on what depression is and where it occurs in the brain and why it occurs there. So some of the neurochemicals that happen or don't happen and that cause us to get into a depressed state. So this is a pretty good video. So make sure you give it a look. Here's some of the signs and symptoms. Just to give you kind of an illustration, a little informatic here that you can pull up and take a look at. Just give you a general idea of what depression, the signs and symptoms. Once again, if these things are just happen within a few days and go away, that's pretty normal. But if it occurs more than a couple of weeks, then you're in a depressed state that probably needs to be treated with professional help. Mental health among students. Make sure you look through this slide. These are fairly accurate numbers, and just updated. So, and you can see why. I mean, college students go through a lot of stress. It's not just being in a new place around new friends. It's also taking on new challenges that can be stressful. So this is a pretty prevalent occurrence, and something that we should probably keep an eye on our friends and kind of do a self-check every once in a while. Make sure that you've got that good, positive, subjective well-being going, and that it should be a majority of the time. Not to say that it has to be every day, all day, because we do have to go through some challenges, both physical and mental, when we're at school. Just for the sake of learning, it's part of the process that we have a little anxiety or anguish or stress, but it's how we deal with it that allows us to progress. So understand that. We certainly don't want to form bad habits like drinking and other things that'll kind of mask the issues, and we don't want to do that. Make sure that we handle this stress and learn how to handle it, so that we're prepared to meet new challenges in the future. So there are some treatments, and here they are. So make sure that you look over these, because it might be on your exam, and they're really good to know. Understand that lifestyle changes by exercising and doing things like that work really, really well. Matter of fact, some studies are saying that they're just as effective, if not more effective, than your antidepressant medications. So you'll find that a lot of physicians and psychiatrists will make sure that you're exercising as well as their prescription of antidepressant medication. So pretty interesting stuff, pretty interesting research going on out there with exercise and anxiety and depression issues. One of the sad parts of depression is suicide, and it is the second leading cause of death in that age group. That hasn't changed for a long time. That statistic is still there. There are some of the warning signs. Make sure that you understand some of those. Make sure that you understand those warning signs and you can recognize them in other people. It really is good to kind of keep an eye on folks. None of us, unless we're clinically trained, can help, but we can always be a friend. But to get really good help, those that are contemplating suicide really do need to get some professional help. There is a suicide prevention lifeline. You can call that if you feel suicidal, but if you know of somebody who is and you're trying to help them, you can give that same phone number a call and get some advice from some professionals, and they'll kind of walk you through on how you should approach this person and how you should kind of get them some help, or how you can get them some help. So here's some of your professionals. Make sure you know the difference. Just to point out, a psychiatrist can prescribe drugs. They're a doctor. They have a medical license. Your psychologists usually have a PhD in counseling, but cannot prescribe medications. A psychoanalyst is going to create the tests for you, and then they'll interpret them. And they usually hand those tests then over to a psychologist to do something with that test. Social worker is trained for counseling. They typically a master's, and they do have a lot of experience. This is usually the most common way people receive help with their anxiety and depression issues. Typically, a social worker or a psychologist will then refer to an MD, whether it's a psychiatrist or a general practitioner or some other, to then provide medication help as needed. So there is also something called a psychiatric mental health nurse practitioner. That's a registered nurse that specializes in psychiatric practices. My mom used to do that when she was a nurse way back in the late 70s. So there you go. What to expect. Make sure that you understand that you have to kind of talk. Well, not kind of, you have to talk and be open. So if you don't feel comfortable with your therapist, make sure you find someone you're comfortable with. That's really what this slide is talking about, because it is about communication. A lot of times the lack of communication brings on that anxiety, the inability to understand your own emotions, your own physical state, your own mental state, and then be able to communicate that with others is really a big stumbling block when it comes to treating anxiety and depression issues. So the ability to communicate well will help you overcome these issues. And that's just one aspect. And a counselor or a therapist will help you do that. Good video to watch talks about the teenage brain. So make sure that you look at that, and you'll get an idea of why it is that it is so important to form good coping strategies as a young adult. It carries on throughout life because it hardwires your brain to handle stresses in a positive way. So watch this video and get an idea that it really is a process, and it's a chemical process that we can train to make our brain stronger against certain stresses. Here's what you're going to learn from that. But don't cheat. Don't skip ahead. Make sure you watch the video. All right, you guys. So that's that. Make sure that you read through those again and that you're prepared for your exam. Text or email me if you have any questions.